Tēnā koutou katoa. My name is Ka'ula Kanaki. I'm a health psychologist and manager of the psychological service at Cancer Society, here to introduce and moderate a panel of very passionate and skilled physiotherapists who are keen to share their insights, reflections, and recommendations on the benefits of exercise in a cancer treatment plan. This topic came about as many of our patients expressed an interest in playing a more active role in caring for their bodies as they prepare, undergo, and recover from treatment. Before I introduce our speakers, I thought to review a few housekeeping updates. To help limit distractions throughout the presentation, I've automatically muted your microphones to ensure there isn't any background noise. If you have a question at any point throughout the presentation, please ask them in the chat section, as we'll have time at the end of the presentation for a Q&A. After our presenters speak to their topics, the panel will take a further 2 minutes to discuss any further thoughts or reflections. Finally, I'll be keeping time to ensure that we run on schedule, so I may interject to ensure that we have time at the end to review those questions. So with that said, we have a stellar lineup of speakers, including our first speaker, Shannon Riddell, who's the lead lymphedema therapist with Te Whatu Ora, which is previously Auckland District Health Board. She works within the private sector, providing cancer rehabilitation, and has a special interest in breast, head and neck, gynecological cancers. Shannon will speak to us on the evidence for exercise in a cancer treatment plan. Our second speaker, Megan Schmidt, is the manager of the Wellness Center at Harbor Cancer Center. Megan has over 20 years of physiotherapy experience and has spent many years specializing in oncology physiotherapy and is a Pink and Steel certified therapist and trainer. Megan will speak to us on exercise pre, during, and post-cancer treatment. Our third speaker, Claire Boyce, has been providing lymphatic and cancer rehabilitation care for over 10 years. She has worked in the public health service, developing acute breast cancer services, and transitioned to Active Plus Albany in 2014, where she is the oncology team leader. Claire is a Pink and Steel cancer rehabilitation certified and will explore common barriers to exercise and ways of overcoming these barriers. Our fourth speaker, Joe Clouden, is the driving force behind Sea Wellness on the Kapiti Coast and has over 20 years experience as a physiotherapist. Joe is a Pink and Steel cancer rehabilitation certified physiotherapist and is focused on improving outcomes for people following a diagnosis of cancer. Joe will lead us through a practical exercise component, including recommended breath work and general exercises. And our final speaker, Shannon Fiskin, a member of the Body in Motion team. Shannon qualified as a clinical Pilates instructor with the Australian Physiotherapy Pilates Institute, has completed further Pilates equipment training and also antenatal and postnatal Pilates through APPI. She's also a certified Pink and Steel cancer rehab physiotherapist. Shannon will introduce a Pink and Steel video to show how the program works and the benefits from a patient perspective, as well as highlight ways of accessing oncology rehab in private, public, and community settings, along with Shannon Riddell. So without further ado, I'll hand the mic over to Shannon Riddell.
Thanks, Kala. Probably help if I unmuted my microphone. Thank you everyone online who's joining us today for this webinar, and a big thank you to Koala and her team at the Cancer Society for inviting us to speak to you this afternoon. There's been a lot of work going behind the scenes, so I just want to thank everybody that has been involved. So it's a big privilege to be presenting along with these very experienced and talented therapists. So as Koala said, my name is Shannon Riddell, and I've been an oncology physiotherapist in acute, outpatient and community settings, both in public and private, for the past 10 years. I'll be starting today's webinar by talking about what we know regarding the evidence for exercise in cancer and how this can be of benefit to you and your loved ones who've have a diagnosis of cancer. Next slide, please, Kalma. Great. So the medical profession has come a huge way in the past couple of decades when it comes to cancer treatment. And as a result, we're living longer with and following a diagnosis of cancer, which is really great. However, being disease-free does not necessarily mean being free from your disease. And we commonly find people are referred with high levels of fatigue, have lost a lot of strength and conditioning, and they may have impaired balance or mobility, have lost confidence in their bodies, and have high levels of anxiety and are low in mood. As a cancer rehab physiotherapist, I see a lot of people who have found it hard to return to their lives and do the things that they loved following cancer treatment. It doesn't need to be this way though, and this is why I'm passionate about helping people to live well and find the enjoyment in life following often challenging and difficult road following a cancer diagnosis. New slide, please. So the evidence, it's a well-known fact that being active is good for our health. But when it comes to cancer, exercise could well be one of the most powerful tools in our armour to protect us from cancer, against cancer recurrence, and from mortality from other health conditions such as heart disease, stroke, and diabetes. Evidence from a significant number of published research studies has shown exercise is safe and is an effective adjunct therapy in cancer care. Experts in exercise oncology are now calling for physical activity to be seen as the fourth treatment option for cancer, and for it to be included as a standard in the care package for anyone with cancer. To back this up, there's a growing body of scientific research to support this. So exercise has been observed to have a protective effect against cancer recurrence. It is possible to reduce your risk of cancer recurrence by around 30% just by being active and regularly exercising. Exercise also has a protective effect against cancer mortality and all-cause mortality. So you can lower your risk of cancer coming back, along with other conditions such as heart disease, stroke, and diabetes. Next slide, please. So I know this is a very busy slide and it's probably a little small, so we can include this in the helpful links along with the presentation later. But I just want to summarise and point out the main recommendations from this publication, which has come from the American College of Sports Medicine. Essentially, being active can help you overcome many of the debilitating side effects from surgery, chemotherapy, and radiotherapy, which are listed here. There is strong evidence for exercise to reduce cancer-related fatigue, improve health-related quality of life, physical function, improve mood, and reduce anxiety and depression. As a lymphedema physiotherapist, I often have patients who are either at risk or have lymphedema, and they're worried that lifting or pushing or pulling weight will worsen their lymphedema or bring on the condition. This simply is not true, and unfortunately we're having to undo a lot of the previous false information that's still circulating on the internet. What the research has shown is that strength or resistance type exercise is safe and does not exacerbate lymphedema when this is done in a gradual and progressive way. Should you have concerns about where to start, I would recommend talking to a lymphedema therapist or a pink and steel therapist who can graduate the exercises for you and towards your goals. what this diagram is showing is the dosage. So for example, if we're wanting to address or prevent cancer-related fatigue, what this is recommending is 3 times 30 minutes of moderate aerobic exercise a week, as well as 2 resistance-based sessions of 2 sets of 12 to 15 repetitions of a particular exercise, working on the major muscle groups. So this is a document that we as physiotherapists use to guide and prescribe our exercises, and can cater that based on the side effects you may be experiencing. Next slide, please. So whilst there isn't an agreement about exactly how much exercise you need to do to reduce your risk of cancer mortality just yet, most studies are based on a minimum of 150 minutes per week. So overall, more activity appears to lead to better risk reduction. What this might look like is 20 minutes of something every day, or 30 minutes on 5 days of the week. So it also needs to be at a moderate intensity, and this is where you get a little bit out of breath and your heart rate increases. It doesn't mean that you have to be gasping for breath or red in the face, or working at your maximum. So brisk walking will do the trick, but you'd need to go at a reasonable pace. There's also a dose response, so the more you can do, the lower your risk. But generally anything is better than nothing. So I wouldn't worry about how much you can do now. Just start somewhere and gradually build on that. I think the main message is just trying to avoid inactivity. Next slide, please. So we also talked about strength and resistance-based sessions. So muscle strength promoting exercise or strength training is recommended twice a week. Now, this doesn't have to be difficult, as many people might think it is. Again, a little and often approach is the best way to tackle it. Maintaining our muscle mass, especially when we get older, during illness or after surgery, should be a priority. Muscle strength promoting exercise involves working against some sort of resistance to build muscle strength or prevent muscle loss. This doesn't have to be weightlifting at the gym. Using exercise bands or small weights at home, or doing things like squats or push-ups using your own body weight are great. Also, lifestyle activities, especially if you're lifting, carrying, pushing or pulling, can help to keep your muscles strong. Next slide, please. Getting back into regular exercise is one of the most difficult things to do after a cancer diagnosis. To be fair though, the vast majority of the population aren't active enough for good health. So it's no wonder getting started and staying active is hard after your body has had to deal with cancer treatment. Next slide, please. So we realized that for some people, it's hard to know where to start. My suggestion would be to start by avoiding inactivity and try to be as physically active as your condition allows, and try to resume your normal activities of daily living as soon as possible. So this may include doing supermarket shopping, light housework or cooking, going for a short walk, or taking the dog for a walk if you have one. If you're physically struggling with resuming your normal activities of daily living, I would strongly suggest that you seek a referral from your GP or any of your medical team to see a physiotherapist, as we're here to help you get back to your normal function, regaining your independence and doing the things that you enjoy. Once you have returned to your normal daily activities, you can then progress towards moderate intensity movement or exercise such as brisk walking or resistance type exercise. This is where seeing a cancer rehabilitation therapist who has specialized training in exercise prescription can tailor an exercise program and make recommendations based on your individual treatment-related side effects, the disease course, and any current health issues you might have. So we're going to cover more on how to access a physiotherapist later in this webinar with my colleagues. Thank you.
Thank you, Shannon. So this is the opportunity now, just as the panel, to share any thoughts or provide any further advice or recommendations. And if not,
on mute still.
yeah. So I think at this stage you can unmute. Yep.
Yeah, it was a great first intro, Shannon. So I, at this stage, don't have anything
Thanks, Jo.
to add.
Okay, great. So we could begin now with Megan, just to speak to us on exercise pre, during, and post cancer treatment. Sorry, Megan, you might just need to, oh, there we go. Can't. I'm unmuting you now.
Okay. Carla had me muted and I could not get out of the screen there. Hopefully you can all hear me now, and thank you so much for having me along. Shannon, that was great recap of the overwhelming evidence that exists for exercising during cancer treatment. So I just wanted to talk to you guys a little bit about me and what I do. And I work in a private oncology centre in Auckland, and it's my job to kind of get people exercising while they're going through chemotherapy treatment, so while they're on active treatment. And it's a great area that I work in, and I'm going to talk to you about that today. So Carla, could I have my first slide? Okay, so sometimes I like to talk to you about going through cancer treatment is like going through a marathon, you know. So let's talk about neoadjuvant chemotherapy first. So neoadjuvant chemotherapy is where you've had a cancer diagnosis, but you're going to have your chemotherapy first, and then you're going to have surgery following that. So in this case, we're going to look at your surgery as like your marathon, and your neoadjuvant chemotherapy is like your training period for the marathon. So you know that you have a date in the future, that's your start line for the marathon, that you can train for. So we have this beautiful period of time where we can work on building up your strength and your conditioning to get you to the start line. However, you're also going through chemotherapy at this stage. So it's like someone has put this weighted vest on you and they're asking you to go out and do all these training runs for a marathon that you've never done before in your life. So it's quite difficult to actually engage in exercise for the very first time, and you've got this start line looming coming up. But you know, and everyone's telling you that if you can get in the best shape of your life, then the marathon is going to be a little bit easier, or your surgery is going to be a little bit easier at the other end. And then we also have adjuvant chemotherapy. So this means, in this case, the chemotherapy is your marathon, and this marathon has just been thrust upon you with no warning whatsoever. So you've had a cancer diagnosis, you may have had surgery, and then you have to run this marathon. So not only are you running your marathon with a weighted vest on and no training whatsoever, you also have had surgery. So it's like you're running with an injury as well. So you have lots of these obstacles, lots of these barriers to exercise, but still you've got to get through this marathon somehow. So how do you do that? How do you do that? So let's have a look at my next slide. So in both of these cases, let's approach your cancer treatment. So whether that's surgery or whether that's chemotherapy, that's your marathon. And you wouldn't just go out and run a marathon if you've never done one before without like maybe seeking some advice or getting a training program going. So in this case, I would really recommend that you get a coach, and that's your oncology physiotherapist that we're talking to you about here today. And your coach is then able to write you a really tailored program. So your coach is going to be really knowledgeable about the treatment that you're going through, any previous injuries or health conditions that you may have. Your coach is going to be able to set little achievable goals for you along the way, and really keep you safe with your exercise heading towards your marathon. Okay. Again, if you were starting marathon, you would build up your miles slowly. So you wouldn't just go out and do a 20K run straight off the bat. You would start slowly. And again, that's where your coach or your physio comes in a really, really important person for you to touch base with, build a program, and start to progress that program as your treatment goes on. You would also, if you had any little niggles or any injuries in your training program, you would address them. So in this case, if we're talking about chemotherapy, we're talking about your side effects. So there's a whole range of side effects that you guys know about. You don't need me to tell you about them, but your coach or your physio is able to kind of change your program and incorporate what would be best for you on certain times of your treatment cycle, and to tell you when to exercise to get the most out of your exercise. So the peak times for exercising. And on some days, let's be honest, you don't feel like training at all. You don't feel like running. The weight vest is too heavy. The injuries are too painful, and that's okay as well. So you have to give yourself permission that it's okay not to exercise all day, every day of the week. Okay. So on those days when it just feels a little bit too much, we could do a stretch session. We could do a yoga session. We could do a relaxation session. We could do a breathing session. We could do some massage with you. So your coach or your physio is well equipped to be able to offer you all of these training modalities, okay, to going through this marathon with you. But the next day you start again. Okay, so you are going to have down days. You are going to have days when you don't feel like doing anything, but the next day you get up and you start again. You are going to make it through this marathon. Okay, so I work with people all day, every day, going through chemotherapy treatment. You are going to make it, but a little bit is your choice as to what kind of state are you going to be in at the end of your marathon. You know, you can choose to be really proactive about your exercise. You can really choose to, you know, meet those guidelines that Shannon was talking about to get the best out of your marathon and the best out of your body, or you can choose not to. And let's just have a look at the next slide, Carla. So here we go. Here's two guys. One's crossing the finish line and one's crawling. All right. So there is a little bit of choice here for you guys to embrace the exercise message, and make your marathon, whether that be your surgery or whether that be your chemotherapy, make your marathon just that little bit easier for you. And we are here to help you. We're your cheerleaders along the way. I've seen it work, and you know, there's always going to be excuses to exercise. I have so many excuses not to exercise myself, and your excuses, you know, yours are better than mine, but my colleague Claire is going to talk to you next about how to kind of get around some of those barriers to exercise as well. And I'm here to say that I've seen it work. You know, my day-to-day practice is just such a pleasure to work with people, getting them to their start line or getting them to their finish line. So, and then I guess the other thing to say is, like, maybe you've finished, people out there have finished your treatment, you've run your marathon, you've got your medal, and you never want to run another marathon in your whole entire life. And I don't blame you for that. But what Shannon just told you, that if you can maybe meet those guidelines of 150 minutes of exercise a week, plus 2 or 3 strength sessions a week, you're never going to have to run another marathon. So that would be kind of good motivation for me. If you didn't like your first marathon, then let's just try and do little and often to try and prevent another marathon in your future. And my last slide, Carla. This is just to remind you that people of all shapes and sizes and ages can run a marathon. Okay, so there really is no excuse. If you've never been an exerciser before, that's all the more reason to start now. And if you have been an exerciser before, then you need to consult someone that can give you a really balanced program. And for someone that is a lifelong exerciser, we might start a lot higher than someone that we're starting off who is new to exercise. So again, that's the importance of consulting an oncology physiotherapist who can write you a program that's really specific for you. So good luck in your marathons, guys. I hope you never have to run another one again. But if you do, then we're here to help. And I'm going to hand it over to Claire to talk to you about getting around some of those barriers.
All right. Just before we head into the barriers, I thought I might bring it back to the panel to see if you guys had any further thoughts. What a reassuring and exciting message, Megan, that this is a team effort and that there's a team to back everyone out there. Thank you.
Yeah, well done, Megan. I really like that analogy of, running a marathon. I think brilliant. And yeah, I again see it as well. I see patients a little bit further on down the track than you do, but I do notice the patients that I see who have maintained their movement and their exercise through, pre and during that marathon have actually fared far better in terms of the side effects that they present with, and you really can tell the difference between the exercises and the non-exercises. So yeah, I'm just really hoping that our message today inspires people to start exercising if they aren't yet.
Thanks, Shannon.
And I would just add in there too that it's always okay to ask for help, and we're going to give you some advice, some options of how to get the help you might need. We're physiotherapists presenting today, but we also know that physios can be quite terrifying for people who might not love exercise. But what I'd like to say is that we come at this in the role of being partners and meeting you where you are with how you're feeling on the day. And we really do love partnering with people to empower great results. So we know that not every exercise is great for every person. Please don't be scared.
Thank you, Jo. We do have a comment. Oh, yeah. Okay. So we might then head into the next session with Claire, looking at how we might reduce the barriers to exercise. Just begin here.
Thank you. Okay, so when we look at what are people's barriers to exercise, and it's not just exercise, it's also activity. So these are examples that I've listed that people, either my clients have shared over my clinical experience, they're common themes, or that people have offered through willingly sharing their stories with Pink and Steel. So people have put themselves forward to do videos, people that have completed a cancer rehabilitation course. And the reason that people offer to do this is that it helps them and they know it takes encouragement, and people need to be supported to engage in exercise. So people have given us their feedback. What was it that wanted them, or what was it that discouraged them from starting to become active again? And it can be symptom-based, so chemo brain, mental or physical fatigue, pain. But it's also things like feeling isolated from your normal activities because you had a normal before you had a diagnosis, and then you've got this new normal going forwards, and it's not knowing quite what your place is yet. Your whole system's had a bit of a reboot. Perhaps you feel like your body isn't capable of doing what you did before. And definitely one of the big questions is, and we get at people coming in and say, I got told to come in and somebody suggested it, but really, is exercise actually going to do anything for me? And hopefully you will gauge from the evidence base what Megan and Shannon have already shared. Yes, it is going to help. But these symptoms are really, these barriers are really normal. That's, I guess, what I want to get through is that this is normal for you to feel this way, that you don't want to engage. You might have more specific concerns also. So if you haven't already had it, or if you don't have lymphedema, your concern might be, what if I provoke lymphedema? Or if you do have lymphedema, it might be, what if I make it worse? Or perhaps it's you've already had surgery and you're worried that actually exercising, what if I damage my surgery? Or I have brain fog, I can't quite concentrate, or my balance isn't that great, or I have peripheral neuropathy, that pins and needles in your fingers or in your feet. And so you might not be able to undergo the same tasks or types of exercise that you envisage. And this is where the skill set of your therapist comes in. Can we go to the next slide, please? So exercise is one component of a multimodal approach. So our aim is to improve your overall well-being. Of course, physically, we want to get you fit and active and re-engaging in life, but that's also a mental well-being. It's how you're coping. Exercise, or your cancer physiotherapist, we form part of the wraparound service to your medical team. So other elements of the wraparound team might be your speech language therapist, your dietitian, counselors and psychologists, and occupational therapists. What they've found is that there's two elements that help you get through your cancer diagnosis that will aid you in developing a sense of resilience and coping, and that's optimism and mastery. So optimism is the tendency to expect a positive outcome, and mastery is a perception of control over the outcome. And it's linked with self-efficacy and with hope. So what people have shared, and these are the same from the same videos where people have come forward with their stories, what people have shared is once they've completed their course of cancer rehabilitation is how did it help them? So it might be that it's mentally and physically stimulating. But in terms of giving you a sense of mastery, exerting control, it gives you a structure, and it's not just attending medical appointment structure. It's people can come through and they're concerned with, it's actually a struggle to get out of bed some mornings. They're not able to do their normal routine, and therefore you might have feelings of feeling like a failure, feeling unproductive. And this all adds to your fatigue, and this all has very negative connotations on your overall health and well-being. So with exercise, there's one element that can assist with mastery and optimism. It's you can control what you do, when you do it, how much you do. So this is giving you a structure. Also, our focus isn't just on having eradicating the cancer cells and having clear scans. Your physiotherapist side, we're looking at how are you feeling, how are you coping. Let's focus on getting well again. So it's a whole body. And we have a familiarity with common side effects to your treatment. So your physiotherapist, particularly someone that's undergone a oncology training, cancer training, so such as through Pink and Steel Foundation, will have a familiarity with common side effects such as lymphedema, scar sensitivity, nerve pain, common movement problems that you might have from different types of cancer and different surgeries, challenges in your balance and coordination, and also ability to concentrate, and your fatigue levels. And this is why a tailored approach is so important. You can't just go online and start Googling, how do I become active again? It takes a bit more than that. And what we work through is people from, as Megan said, prehabilitation, so before you undergo a surgery, so helping you build that resilience, giving you coping strategies to get through that marathon, as Megan put it, all the way through to people with advanced cancer. And that's where we're looking at instead maintaining your independence, giving you dignity, supporting your quality of life for as long as you can. And then we have the high-end people that need to get back to a certain type of sport, or maybe it's your occupation is actually really physical. Maybe you didn't do exercise before your cancer diagnosis, and your exercise is actually your occupation. So firefighters, tradies, police officers, these are people that I've worked with, and I'm sure my colleagues will have worked with, where your activity is, we may need to make you fit so you can go back to your sense of normal is your occupation. And what we'll do is your therapist will take different outcome measures, and these can be range of movement, how much you can move your arm, how much you can move your neck, circumference measurements, so we can monitor for things like swelling, or if your clinic has it, so a lymphedema trained therapist like myself, Megan and Shannon, we have access either to a SOZO or lymph scanners, so we can monitor that very accurately. And we do these things so we can also build on what exactly do we need to work on. So we can measure your strength, we can measure your fitness at your baseline. And it's great for us because it's very gratifying for your therapist, as well as it being quite rewarding for you, that when we retake these measurements at a later date, it's important that we acknowledge the achievements that you've made, the progress you've made, because sometimes going through a journey, you don't recognize that you're actually getting better because you still have fatigue, but actually it's not as bad as it was. So that's where your outcome measures come in. And our exercise options, the way we get around introducing activity. For some people, it will start with doing activities of daily life. That could be something at home. We can include exercises at home using either no equipment whatsoever, using just your body weight, or even lay on your back if that's what is required, through to using TheraBands or resistance exercises. If your clinician's clinic has different types of machinery, so Pilates machinery, which we, and again, a lot of my colleagues here will have, we can use assistive devices, so gravity machines that will take a lot of your body weight off, so then we can retrain muscles, get you through range of movement in a supported setup. Now, the time of day your therapist will also be able to assist you with. The time of day of when you exercise will influence factors such as fatigue and also your ability to sleep, because you need good sleep. That's your rest and restorative phase. Also, the quantity of exercise is quite important. Doing too much can worsen your fatigue. And this is, keeps coming back to a tailored approach. This is why we need one-on-one sessions so we can figure out what's important to you and what do we actually need to work on. And the exercise options, so you can work in one-on-one settings or in groups, and that's what Shannon F is going to go through in a moment, are the different options available to you, because group settings are important for some people. That's a social aspect. Your physiotherapist will quite likely work through not just one type of exercise, and so it won't just be resistance, so it won't just be a yoga base. We'll use elements from all different types of exercise means to, again, make it meaningful for what you need to achieve. So hopefully you'll be able to see the barriers that were listed on the last slide, the fatigue, poor sleep, pain, low mood. These are all things that exercise has been proven to have a positive influence on. Thank you.
Thank you, Claire. That was wonderful. What I'm struck by also is just how important mastery is in a person's recovery, and certainly from a psychological point of view, that's often what we come back to, is what is within someone's control to manage their situation and their cancer. So thank you for bringing that up.
All right, I think that's a really cool thing about what we do, particularly when we've had, everyone here, I think we've all got over a decade of experience just in cancer. Is that we've worked with, I love the evidence base, so I do a lot of self-directed learning, formal terms, and so I do a lot of reading. It's not just about the physio component. I like to read about what's coming out of the psychologists, what's coming out of the dietitian, how nutrition helps. It's not my role, but at least we have the knowledge base to say, actually, I believe this person might be able to help you. And that's that wraparound service, isn't it? It's not just exercise. Of course, we're talking about exercise today, but we work amongst the whole team and with your medical professionals to make sure you do get the best outcome.
Thank you, Claire. Were there any further thoughts or reflections from Claire's slides? We could head into our next section, which will be introduced by Joe.
We might have to go back a slide so I don't have to look at myself while I do my little blurb first.
Okay.
Cute. Tēnā koutou katoa. One of my top tips for exercise is to focus on the why, or your why, because if you know why, what you're moving towards, it can make some of the steps and especially some of the hard work way more achievable. And acknowledging that you have a choice to move your body in whichever way works for your long-term health needs. I've prepared a short 6, might be 7-minute activity break. Sometimes we all require restorative movement, and sometimes we do better with working harder and faster. But today I won't have you dropping and giving me 50 push-ups. Each of the simple movements that we're going to do today will bring attention to your breath, with the aim of reducing the effect of stress hormones on our nervous system, reducing fatigue, and ultimately this type of activity may improve our immune function. So move safely of your own free choice, preferably with a smile. And if you can please stand with me, or you may choose to perform in your chair. Paola, you can press play, please. Thanks for joining me today for this simple stress relieving sequence. If you've chosen to join me in standing, we're going to arrive in our standing position and become aware of our grounded or centered standing position. If you've chosen to stay seated, just follow us through and choose to ground onto in your seated position. The moves will work totally fine in seated and sitting also. So if you are standing with me, I'm going to bring our awareness to our feet and just become aware of our balance between right and left. So just become aware, are you taking more weight through your right leg, more weight through your left leg? And can you center that up and bring your balance through to being centered through your right foot, through your left foot? And then become aware of having all 10 toes on the ground. Bring your weight back through the center of your heel and roll slightly forward through those toes again, and see if you can find your centered position through the arch of your foot in that direction so that we're centered in each of those positions. Now that we're grounding down, bend your knees, allow those to relax a little bit, and in contrast to the grounding down, think about having your spine tall. You might like to think about elevating up through the crown of your head just to allow your spine a little bit of space as we prepare for our first stretch activity. So we'll begin by floating our palms up and coming in behind our neck. And we're going to go for a side stretch where we open up our side body or our trunk, coming off to the side to feel a stretch through our side body. If taking your hands behind your neck is too tricky, you can also bring your hands to your shoulders or hands onto your hips. Or if you feel like you'd like a little bit more, you can bring your hands all the way up, clasp hold of your wrists and come off to the side to open that side body. You may also like to take your back leg behind and bring your attention to your breath, and as you take a deep breath in through your nose, use that deep breath coming down into the base of your rib cage all the way down here to open up your side body still more. We're going to come back to our centered position and repeat to the opposite side. So choose where you'd like to start. A reminder that might be hands behind your neck, hands onto shoulders, hands onto hips, or coming up and overhead. Whichever position you choose, come off to the side. You might like to add in that foot coming behind. Open your side body. Breathe in. Bring your attention down here to the base of your rib cage as you breathe in through your nose. And breathing out, return back to your grounded standing position. Very similarly, our second exercise floats our palms up, coming in behind our neck. As we breathe in, shrug shoulders up, scrunching up Shoulders up towards your ears. Become aware of any tension you might be holding in this area. And then breathe out. Drop your shoulder blades down away from your ears. Create space between your ears and your shoulders. Breathe in. Take your elbows back behind. And breathe out. Float your arms back down. Stay where you are as we repeat that exercise. I'm going to turn on the side so that you can see what happens when we open our elbows back behind. So once again, we're going to float our hands, palms in behind our neck. Breathe in as you shrug up. Become aware of any tension. Breathe out. Shoulder blades drop down away from your ears to create space between your ears and your shoulders. Breathe in as you open your elbows behind. But just become aware, check in that you're not popping your rib cage forward, so you can use your abdominals, connect from the base of your rib cage to your hip bones to create a little bit of tension to hold your trunk steady and stable as you stretch your elbows behind, and then breathing out, float your arms down. Same move, palms come in behind your neck, breathe in as you shrug up. Breathe out, let your shoulders relax down. Breathe in as you open your elbows behind. Breathe out, float your arms out. Last one of this set, palms come behind your neck. Breathe in as you shrug up. Breathe out, create space between your ears and your shoulders. Breathe in as you open your elbows behind. Breathing out, float your arms back down. For our third exercise, I've come back into my grounded standing position. My feet are shoulder width apart. I'm going to allow my knees to bend down into a little bit more of a squat now. And my hands come out in front. This exercise is called row the boat. So take hold of your imaginary oar and you're going to pull that oar in towards you. We're going to float our arms, palms come up. Float our arms back to our start position. Take hold of your oar. Elbows come grazing in by your side. Turn your palms up to float around. Now we can add our legs into this, and as you pull your oar towards you, straighten your knees and float your palms around. So this becomes a little bit more of a whole body exercise. Starts to simulate our circulation a bit more. You might feel your abdominal muscles, your tummy muscles becoming involved as you pull that oar towards you. If rowing the boat's not your thing, you might like to change it and think about paddling your waka, or perhaps paddling, canoeing where you're using your kayak, or perhaps thinking about tennis a little more, whichever sport or activity makes more sense to you. But for now, we're just going to carry on rowing our boat. Grab hold of your oar, pull your elbows in by your side, turn your palms over as you come around, pull your oar and float back around. Come back to your standing position and join me with one hand on your tummy, one hand on your chest in the area of your heart. Become aware of your breathing. There's no need to change your breathing. Just check in. Has that changed at all? Are you breathing a little more than when we first began our exercise? Perhaps you can feel your heart beating underneath your top hand as we've moved through our circulation exercise. Thank you for joining me today.
I hope you've enjoyed Joe's simple stress relieving sequence. Unfortunately, due to technical difficulties on the day, the recording of the webinar was interrupted. Following the gentle movement exercise, our presenters were keen to share a story from Ruth, a pink and steel patient who reflected on her experience in returning to exercise and life through a cancer rehabilitation program. To view this video, please refer to the links provided in the description of this webinar. Up next, you'll hear from Shannon Fiskin and Shannon Riddell on the ways of accessing physiotherapy input?
Cool. Just before I start this, but the Ruth story is actually one of my patients, and yeah, I think it'd be really great if you do watch Ruth's video, because she is awesome, and it links in quite nicely to what Paul was saying just before about being a bit nervous about accessing some rehab. Ruth discusses that in the video, and then how far she's come. So she's really worthwhile watching. It's about 4 minutes, so it's not too long. In the chat questions, there was a question about, I think, from Kim. So this hopefully will answer what you're after, Kim. I work in private practice. So I work in a private musculoskeletal clinic in the Mount in Tauranga. And I see mainly cancer rehab patients now. So I'm going to talk about accessing cancer rehab in the private sector, and then I'll hand it over to other Shannon, and she'll talk about accessing in the public sector. So there's various ways you can access Pink and Steel in terms of how you pay for it. If you have private health insurance, then that will often cover some physiotherapy. You'll have to look at your individual policy or talk to your case manager to see exactly what it will cover, but that can be an option for some patients. We're always happy for people to pay privately, but obviously that's financially not always an option for people. Having cancer treatment can be really financially draining. So we keep it there as an option, but we obviously understand that that's not an option for everybody. So then if we move down into funding, this is where it gets a little bit tricky. And to be fair, it does get a little bit confusing, I think, for the patients. So my advice around that is, first of all, if you're looking at accessing any sort of Pink and Steel funding in your local community, is that you either reach out to one of your local therapists, because they can give you really specific information for your particular region, or you contact Pink and Steel, and we have got a link, I think, coming up or at the end, that has got the inquiry form or the referral form for Pink and Steel. They can then direct you to your local branch or your local physiotherapist, who can just help you a bit more specifically. But generally speaking, we have different pools of funding depending on what type of cancer you've been diagnosed with. Breast Cancer Foundation New Zealand will fund for physiotherapy treatments. They tend to prefer this to be post-surgical. There generally will be a charge that the physio will also add to that, a small surcharge. It normally will be $10 per session, but that may vary depending on where you live in New Zealand. And you do have to apply direct to Breast Cancer Foundation for that. Bowel Cancer New Zealand also offers for physiotherapy treatments. Their criteria is not quite as strict, I don't think, in terms of it can be within the first 2 years post-diagnosis. So they will also offer the 4 almost fully funded sessions. Talk Peach is a gynecological foundation in New Zealand. They, probably in the last couple of years, 2-3 years, have linked in with Pink and Steel. So they do allocate some money to Pink and Steel to help fund gynecological cancer patients. And Prostate Cancer Foundation New Zealand, I think they are now funding 3 physiotherapy treatments, but one of my other colleagues might know more on that. And again, you applied directly to Prostate Cancer New Zealand for that funding. If you get confused, if you get stuck, talk to Pink and Steel and they'll be able to help you. In the last, I think, 3 years again, Pink and Steel has been a guaranteed beneficiary of Dry July. So a lot of you will have heard of Dry July. It's a massive fundraiser in New Zealand, and their beneficiaries are Pink and Steel, Look Good, Feel Better, and prostate cancer, I think. There's 3. And so Pink and Steel has received a large amount of funding in recent years from Dry July, which is absolutely awesome. It's a real game changer for Pink and Steel, and that funds a lot of our group classes, which I'm going to talk to you about shortly. Really important to remember that Pink and Steel rehab is for any type of cancer at any stage. So you might have had a diagnosis many years ago, not received a lot of help potentially at the time, and still be suffering with side effects, or just not feeling like you've ever got back to where you would like to be, we're happy to see you. We're happy to see anyone at any stage. And then Boost is the last one on our list. Boost is also relatively new in the last 3 years. Boost is linked in with insurance and more with income protection, and I think trauma cover. So it's not your health insurance. So if you have those different types of insurance covers, then absolutely talk to your case manager if you have one. Boost is a really comprehensive return to work program. It's multidisciplinary. So generally the physiotherapist will be your key worker. They'll meet with you. They will do a really comprehensive assessment and figure out what your issues are and what we need to progress you through to get you back to work. And then we can involve other members of the team, occupational therapist, dietitian, psychologist, whatever is needed to help support you for your return to work. I've got to say, with the Boost, we don't see as many of them, and that's possibly a little bit of lack of awareness sometimes of the case managers. They don't even know that this is a thing. So if you do have insurance, you know, be proactive, talk to your case manager, ask if you're eligible for Boost, and then they'll probably go away and look it up and find that, yeah, you are. So really awesome program. The take-home message I would say from that funding, we can get you something wherever you are in New Zealand. Even if you're in the middle of nowhere, we can find some funding in some form of delivering cancer rehab to you, whether it's by Zoom, like we're doing today, whether it's group classes or one-on-one. You needn't feel like because you live in a certain location and you haven't got a physio that we can't help you, because we definitely can. I see quite a few women who live in Opotiki via Zoom. So yeah, seek us out and we'll help you. I'll hand it over to Shan R to talk about public.
Amazing, thanks, Shannon. So as I've said earlier, I work in the public system. So now Health New Zealand, we are officially called. And there are fantastic avenues in private. There are some avenues in public as well. Ideally, I would love to see cancer pathways from acute care out into the community and out into outpatient settings. Unfortunately, this has not been streamlined and it can be a bit bitsy, but you certainly can still seek out physiotherapy in public. And that may be in an outpatient setting, it may be through the community. So a community physiotherapist may come in and see you at home if accessing an outpatient clinic is difficult for you. And it may be after your surgery you're having certain difficulties, for example, with shoulder movement, neck movement, or your mobility is impaired. So this is where a physiotherapist or even an occupational therapist, depending on what your needs are, could be really helpful in your situation. So what I would recommend is actually having these discussions with your medical team. So that may be your oncologist, your surgeon. You may have been given some contact details for a clinical nurse specialist. I know sometimes you're given a lot of information in hospital, but if you have a contact, they can do all the groundwork for you and get those referrals sent off so that you're getting the access to the treatment that you need. Also, your GPs can refer you, and they often know the services in the area that you can access. So, as I said before, we have physiotherapy and occupational therapists throughout New Zealand, but unfortunately, there still is inconsistencies, and some centres may be better set up than others. But I would definitely just seek out whatever options you have available to you, whether that be private or public. Thank you.
Thank you, Shannon, Riddell and Shannon Fiskin, for helping us navigate what can be quite a complex system, isn't it? So the main message that comes through is that there is help out there. It's just knowing where to seek that and gaining that input. So thank you for that. what we might do is move into our Q&A section of the webinar.
Couple of messages. I'm not sure if they've come to everyone or just to me. Do you want me to read this one from Mary Ralph? Is it anyone else got that? Would you like me to read that out?
That would be, yeah, that'd be great. Thank you.
Yeah. Thanks for your question, Mary. It says, I have observed that I get really puffed and tired while doing gardening, walking uphill and the like, but on my bike, I can go for a lot longer. My legs get tired, but I don't get puffed. Is this a beneficial exercise? Anyone
Sorry,
want to
we've
chip
just
in there?
forgotten to unmute everybody, so I'm just unmuting. I think Megan, you should be able to unmute now. There we go, we're all unmuted.
Well, I'll start by saying, yes, Mary, definitely beneficial. So anything you can do, I can't remember who said that on their slide, but anything you can do is better than nothing. You know, you're still getting your quads working, your glutes working, you're getting out in fresh air, great for your mental health. So absolutely beneficial. We talked a little bit about moderate exercise and how that was protective. So moderate, they have this scale called the Borg scale, and we can maybe link that later. But it just means that you're getting a little bit puffed, you're getting a little bit sweaty. You can still have a conversation with someone else if you're walking or biking with them, but you wouldn't be able to deliver like a massive long speech to them. So you might not feel like you're getting super puffed when you're biking, but if you're getting a little bit shorter breath, then that would be ideal in terms of the cardiovascular side of it, but you're getting good strengthening on the bike. So keep it up.
There's also something known as the anaerobic threshold, and by working out on your bike, it means that some of those day-to-day activities that you noticed are getting you out of puff, the more training that you do on your bike, and so by sometimes doing, you know, a little bit more uphill on your bike or a little bit longer than your usual bike ride, by improving on your bike, you change how close you get to your anaerobic threshold. And that means that some of those day-to-day activities will eventually make you less puffed to perform them. So keep up the good work, Mary. Well done.
Does anyone else want to add to that? There's another couple of questions that might have only come to me. Best off, this is from Story R, so I'm guessing your surname might be Story. Best time to exercise during a chemotherapy cycle. Do you want to take that one, Megan?
Yeah. So I work with patients that are going through chemotherapy, and the best time to exercise is when you are feeling the best, really. So when you're feeling bad, we have to kind of tailor that. And as I said, it's important to take those rest days, rest and recovery, as Claire said. But you would maybe do a short walk, you would maybe do some stretches, you would maybe do some yoga, breathing, relaxation. But a lot of our patients actually travel to our centre for their chemotherapy. So we tend to grab them if we can on the day of treatment. If they're coming from a distance, we will get them in the gym on the day of their treatment, and then they will go down and have their chemotherapy. But if you're talking about like a 3-week cycle, normally patients will come back to us again when they're feeling better. So I usually let them have that couple of days after not seeing them in the gym, but doing their own thing at home, and then I'll get them back in the gym the following week. So I know I'm not really answering the question, but it is very dependent on what kind of chemotherapy you're having and what kind of cycle you are doing. But there's no bad time to exercise during chemotherapy, maybe. Yeah.
Cool. I think I'll just add to that and say, you know, we talk a lot about this moderate exercise. Moderate will change in your cycle. So, you know, that day 1 or 2, what feels moderate might be getting out of your chair and walking to your couch. And then later on in that cycle, moderate might be walking around the block. So if you can keep that moderate in mind, that will change over your cycle as well.
Yeah, and obviously your bloods, you'll be having your bloods done regularly throughout your treatment. So obviously if your neutrophils are through the floor, then we wouldn't be doing too much exercise then. Yeah.
Cool. Hopefully that answers that one. Next one's just about the laptop crashing, so we'll flag that. Can you discuss funding agencies and how to refer? So hopefully, Kim, that covered what you're after in that last couple of slides.
I just add to that, Shannon, there was a slide that was skipped and it had a pathway process of how to refer. So I think everyone's going to be sent the notes, the slides from today's presentation, so people can refer back to that as well. And then after, there were a couple more slides with helpful links as well. So Pink and Steel link is on there, as is some of the larger cancer organisations. So a lot of them do have individual, you know, as I think it was Paul before mentioned, he was part of a 12-week program, a men's cancer program. So there are those types of programs that are also operating around the country, and sometimes touching base with the Cancer Society or the cancer specific groups, they will be able to provide you with information on what is available in your area as well. So all those links will be available to you after this.
The next question is from Paul. How important is exercise pre-treatment?
Yeah, so that ties into that building resilience and coping. So yes, important in terms of mental well-being prior to treatment. But as everyone else has said, it gets you as good a condition as you can get into, coming back to that beautiful marathon analogy, as best the training you can do prior, the easier the marathon will be.
And one of the things that we see, oh, sorry, Megan.
I guess if we're talking about pre-treatment, it's hard for us to actually catch someone because at pre-treatment, because they may not have had a diagnosis yet. So there is research to suggest that the level of conditioning that you have prior to diagnosis will obviously benefit you through your treatment. But so as a general health message, yes, exercise is important for all of that. But yeah, we can't catch people pre-treatment as such. Yeah.
So, and one of the things that we see regularly is deconditioning over the course of cancer treatments. And so as much as possible, preventing reduction in your conditioning or losing fitness over the course of treatment, we see better outcomes. So training for your marathon, that's why we're doing it. So it is important.
Yeah.
Yeah.
If we can, sorry, because I know we've talked about chemotherapy quite a lot, because there is such great evidence base around exercising during chemotherapy and how it improves efficacy of the medical treatment you're receiving. But I think that also the same goes for radiotherapy, and this is also why, again, you need somebody who's trained, is that you can still be seen during radiotherapy. Your therapist can work on a body part that's not being affected by your radiotherapy. So say a large population base that we have at my clinic, at this clinic, is head and neck cancer. And so we don't have to use these top few feet of your body. We can actually be doing aerobic fitness for the other half of the body, and it's still going to have a benefit for you as a whole, and it's very safe.
Yeah, that's a great message, Claire.
The next question is not really physio specific, so I'll see if anyone has any advice on this, but after chemoradiation treatment, do I need to be extra careful with exposing my body to the sun?
Yeah, I can probably help there. I see a lot of patients following radiotherapy, and the recommendations from the radiation therapists and the radiation oncologists is there is some damage to the skin following the radiotherapy, and so the skin is going to be more susceptible to sunburn. So when out in the sun, it's just being extra careful. I think we should all be careful in the sun anyway, for the harmful rays, but wearing a high sun factor sunscreen, a collared shirt, just trying to keep covered if possible, and that sunscreen, or even being in the shade. I would avoid being in the heat of the day for any particular period of time, because though, that burn could come on a lot quicker than prior to radiotherapy.
Cool. Thanks, Shannon.
And sorry to add again. Yes, because we look at the function that the skin plays and what it does for your body. So your skin is your protective barrier. And the reason it's important in terms of when you have lymphedema or at high risk of lymphedema, or when you've had radiotherapy, is that if there's damage to the protective barrier, and if your immune system has been somewhat compromised, then it needs to be protected. We need to support our skin, and that's from sunburn and also types of trauma. So when you get back into gardening, there are products that can also assist in this. So you might be quite nervous about using a generic sunblock, particularly in summer. And so your oncologist should be able to direct you, your team should be able to direct you to what medical moisturizers they want to use, because medical moisturizers are different to run-of-the-mill pharmacology and that you might get from the chemist, like bio oil. So also looking after scars. It's not just about if you've had chemotherapy or radiotherapy, it's just the scar itself will need protecting from the sun. And you can get specialized medical moisturizers that have an SPF in it, so that it's not going to aggravate the skin at all. Definitely some types of chemotherapy will make you more sensitive to the sun, so you will burn a lot easier, and regardless of where your cancer originally was.
Thanks, Claire. The next one's a good tip from Paul. Prostate Cancer Foundation provides CrossFit gym, and that is funded. I think, is that in the links at the end as well, Shannon? Yeah. And then from Tanya, hi there, great webinar. Will we be able to access the exercise video as a link post-seminar? Yes, I think so. I think
we'll do our best,
and
I think within the resources there'll be some other.
Cool.
Yeah, Kaola, just in case people want to view it sooner rather than later, the link is in the speaker notes of the slide, so maybe we could copy and paste that directly into the chat box.
Oh, that's a great idea. I'll
Copy
do that now.
and put it into Google, and it will come up on their YouTube so they can watch it.
Is that for Ruth's presentation? Yeah.
Oh, sorry, that was Ruth. Yeah, but the video one, yeah, we'll have to send that separately, I think.
There's lots of great videos on the Pink and Steel YouTube. If you go on and watch the Ruth one, then you might be keen to watch some other ones, different male, female, different ages, and so that might be good for different people. That's the last question that I can see on my chat box. I don't know if anyone else got any extra personal ones.
All right, so I've just messaged everyone with that YouTube link to Ruth's story. We do have a few more minutes before we close today, and just there are some questions that we often get from our patients. One being, I'm immunocompromised and worried about getting the flu or COVID, so I've been avoiding going out into the public and group situations. Any recommendations on how I can exercise from home?
Yep, Shannon's done a lot of talking, so I'll take this one. So the Next Steps program is a 10-week program that's run by Pink and Steel physiotherapists, and it is run with no charge to participants, and it's run in many clinics around New Zealand, but it's also run online. So if you wanted to sign up for the next lot of Next Steps classes, all you need to go to is to the Pink and Steel website and then register your interest for Next Steps, and then you'll be sent a registration process to be put in for the next 10-week module of Next Steps, and Shannon or Candice will come into your lounge room for you, and you'll be able to exercise within the safety of your own home there. So we get asked that question a lot, and COVID has taught us a lot, and now we're able to kind of deliver that course for you online. Yeah.
So just click the online option instead of putting your regional area.
Okay. Another question that we often get in our clinic is, I guess, people struggling with motivation. Any suggestions there in terms of how you might bolster one's motivation in getting out there and exercising?
I think there's a couple of strategies that I usually suggest. And I think the first thing is just trying to find something that's really enjoyable for you. There's no point doing an exercise that you don't like. So finding something that you enjoy doing. The second tip would be linking up with somebody. I think doing it in a group setting is always brilliant because you sort of feel that you're accountable, you know, you're booked in, you show up, and also you are motivated by the other people in the group as well. So I think they would be the two main ones for me. And I guess a third one would be, you know, goal setting can actually help motivate us as well. So if we know what we're trying to achieve and where we want to get to, that can help keep our eye on where we're going, and I guess the eye on the prize.
I think reconceptualizing things that you do too. So I mentioned how, and that was taken from people's feedback about that struggling to get out of bed, feeling like a failure because you can't do what's normal. It's also about, you know, celebrate your successes. So once you have achieved something, instead of looking at, oh, you know what, I couldn't do today, what did I actually manage today? And it could be the really small things, going to the letterbox, things like that. One thing I said that we would touch on are the other Pink and Seal programs. So there is a small group that you can do during treatment called targeted classes that got introduced this year through Pink and Steel, and it's for numbers fewer than 6. At our clinic, we've tried to group either types of cancers together, so you've got that communal aspect where you've got something in common, and we've tried to group also genders, because we do recognize men usually will offload or talk better around other men, and as do most of our females. And so there are these small groups that are also now funded through Pink and Steel that at some clinics you will be able to access. And again, that's going back to the Pink and Steel website.
Okay. I had noticed, Paul K., you had made a comment from a person with cancer. My daughter is a physiotherapist, and it was so valuable having a physio help pre, during, and post surgery. So valuable for what you do. Just wanted to share the good work that you guys do and acknowledge the time it took for today's presentation. Just wanted to thank everyone for coming out, showing up, and sending through your questions.